The COVID-19 pandemic is not over. That's the message Springfield health officials are spreading to an increasingly vaccinated population. Good Monday afternoon, everyone. Thanks for joining us. I'm Chris Pisano.
And I'm Jordan Jagelinzer. City officials say people under 50 are now the cause of nearly 80% of COVID-19 cases in Springfield. Western Mass News reporter Audrey Russo is live for us in Springfield with those details. Audrey.
Springfield is seeing more and more vaccinated residents, especially now that people 55 and older are eligible for the vaccine starting today. Still, city officials say it's not the time to let your guard down.
People are getting a little lax out there. I do notice more and more people not wearing masks.
Springfield city health officials are not only racing to vaccinate those who are eligible, but also trying to slow the spread of COVID-19 among those who cannot sign up for a shot yet. 79% of the city's cases, health officials say, are from people under 50. Massachusetts residents who are 16 to 54 won't be allowed to sign up until April 19th, lagging behind Connecticut and New York. Robert Russo of Mercy Medical Center believes the state's timeline prioritizes the most vulnerable populations first.
If there's more vaccine that could be administered or there were gaps in empty appointments, well, then immediately we should increase the categories of people that are eligible.
Roos points out that some variants of COVID-19 could result in carrying higher viral loads and will spread faster. With a new strain that scientists trace back to India appearing on the West Coast, Roos tells Western Mass News the best public health response should be to not overreact, but instead
continue to monitor for these variants, gather the science, and then make decisions based on that information.
Springfield continues to stand up more vaccine clinics, and there's a faith-based effort in the works to increase vaccine acceptance. And health officials say they received doses of the single-jab Johnson & Johnson vaccine that will soon be available.
I think what's going to be interesting is to see how many of our residents are interested in J&J or Janssen. There has been some resistance in the community to that vaccine, and that was based on the earlier efficacy rate where people thought this was less effective.
Again, as of today, people 55 and older are eligible for the vaccine, and people with one serious health condition as defined by the state. Now, since people with 2 or more comorbidities were allowed to sign up for the vaccine back in February, the list has actually expanded. So coming up on Western Mass News at 6, we'll have more on which conditions were added to the list and why. But for now, I'm live in Springfield. Audrey Russo for Western Mass News.